everybody, Andrew here from Polo Reef. Over the years, we have learned a lot about reef keeping. We are ready to pass that information and knowledge off to you. We are going to be taking many concepts of the commercial aquarium and bringing them to the hobbyists. Welcome to Polo University. Our goal at Polo University is to take commercial aquarium concepts and turn them into best practices for all of you at home. Whether you're a beginner or advanced reef keeper, we will cover it all. Follow me? Through our knowledge and our staff's knowledge, you will uncover the best practices to take with you on your reef to the next level. Thanks, yes. You can watch our educational videos right here on YouTube. To enroll, simply subscribe. And there's the bell. We'll see you in class. Hello everybody, Andrew here from Polo Reef. I'm here with Dr. Alex Hall, who has joined the Polo Reef team and will be here as a regular on our videos. Dr. Alex is here really to explain some scientific stuff regarding the diseases, and we're gonna just get right into this and start with Cryptocarina ick. And we're going to move through velvet and Brooklynella in this particular session. You ready, Doc?
Yep, let's do it.
All right. So let's talk about ick immunity and whether ick is present and where it's present. Is it in every tank? Obviously, it's about fish health and their resistance to it, but go ahead. Tell me your take on this.
So I do believe that ick is present in most tanks, but that doesn't always mean that it's of harm to every fish you have. A lot of the times, ick is, precipitated by, a secondary event. So let's say, you had, an ick particle on a fish. Most of the time, they have immunity to deal with that. But let's say you went on vacation, you had a friend feed, they skipped a couple feedings, and now your fish are stressed. That stress can lower their natural immunity, and now you can have an ick outbreak start.
So, keeping them well-fed, consistently, with good quality food, and not making a lot of changes, that's sort of important.
Absolutely, keeping things nice and consistent,
right.
Reduce overall stress, and stress is, even in people is one of the #1 killers.
Yeah.
So keeping stress to a minimum is ideal.
Yeah, I get that sometimes. We already discussed the main symptoms of the fish, the listlessness, the white covered powder, on ick, the dots, even though that's not the parasite, right? The parasite's actually below.
Mm-hmm. Yep.
Let's talk about the baths in general. Whether we're talking about a formalin bath, a freshwater dip, a Cipro bath, what are we looking for in the bath and symptoms of we got to get this fish out of there or push him along?
So in terms of signs that I watch for when I give a bath, generally, if you see them gasping, that's generally a stress response. I'll watch for that. Again, if the respiration or the breathing rate is too high, then I'll pull them out of the bath, especially if they're in formalin where the oxygen levels are already being depleted.
Right.
But again, as let's say you didn't notice those original signs, sometimes we end up getting something called hyperemia or reddening of the tissue. I mean, that's sometimes a stress response, sometimes the chemicals. If I ever see a hyperemic or reddened scales or reddened pigments, if you look at if the fish is white, that white banding like a clownfish will be a bright pink color. If I ever see that, I conclude the bath immediately, and then put the fish in, regular salt water, and then I'll wait 2 to 3 days pending, how it's doing if I try again at a lower dose. If for whatever reason you missed that hyperemia and you didn't, let's say it's an Achilles tang, it could be quite difficult to see that color change. If you start noticing them, losing writing reflexes, if they're not responding to stimuli.
But laying over is not good either, right?
Exactly. And if they're laying over and you poke them and they're still not moving, it's almost already too late. The bath's gone on too long.
Now, can't the formalin also have a bad effect on blood /
Absolutely.
They go into the system also, right?
So in terms of ulcerations on fish, I would never use formalin because one, it's quite painful for them.
Right.
And at the same time, it's now, no longer going to be as effective as what we wanted it to be. We want that fish to not have, essentially any breaks in their epithelium or their skin, because now they're having direct exposure to that.
Same thing with peroxide, yeah?
Yeah, exactly. So peroxide has actually been shown across many different species to delay wound healing. So if you have peroxide on a wound, it will, as an antimicrobial, it will, kill those parasites, but it's preventing healing. And then over time, one, it's not going to either not heal, or two, you're going to have secondary infection.
Now, I know we're getting off topic here, but you see a red spot or a sore on a fish when it comes in, or you're treating it, and now you can't use formalin, you can't use peroxide. It may or may not have parasites, but then there's a secondary thing that's happened. What's your advice? Antibiotics combined with copper? Is that where we're at?
So my first choice when I see an ulceration is if I can't identify what the parasite's causing, is to make sure I seal that ulceration. Using honey is a great alternative because one, it's antimicrobial. We use it a lot.
What do you do with the honey?
So I actually smear the honey over the ulceration. Because it acts.
First time I've learned this myself.
It acts as an antimicrobial, one, but two, it'll stick underwater, and two, it seals that ulcer, so now we no longer have fluid being drawn out of the fish, so it creates a barrier.
Very interesting.
So
any kind of honey, like the bear honey?
The bear works. The bear definitely works, but my first choice is something called Mucunua honey. And that's commonly used in even human medicine as well for ulcers and open wounds.
That's great. As long as we're on ick and everybody thinks UV is the answer, get a UV. We know it helps. We know it clears a little bit of the water column. But you have a slightly different take that you're really just controlling it, right?
Mm-hmm, absolutely.
And it's not gone, and these fish can it gives them a chance, and they get immunity to it, but it still could be in the tank, or they could still be carrying it, and new fish can get it.
Absolutely.
So tell us a little bit about the UV myth.
So a lot of people think, or anecdotally think, that only UV will help clear the infection. In reality, it only clears parasites that leave the system. So if we have a large tank, like this one, for example, the likelihood of all of the parasites leaving is extremely low. I think UV is great in terms of...
Oh, you never wrote in my bull, though, my machine, my UV.
I think UV is great in terms of if you have multiple tanks to prevent infection from one tank to another, as long as there's no cross-contamination and the water from one tank is going through the UV before it goes into the other. But when we have, a large tank, I think that a lot of the times, it may keep the burden down slightly, but one, it'll never clear the infection completely, and two, it'll only, again, kill the parasites that are leaving the system. So in this system, it being the size that it is, the proportion of parasites leaving is going to be substantially less than if we did this on a 20 or 30 gallon tank.
Well, I got 1,000 gallons per minute going through that UV. So maybe this one's different, but I hear you. There is one drug that you and I have discussed. I've actually mentioned it on the video, that the sulfa TMP, which you can buy at National Fish Pharmaceuticals, is where I get it. The TMP stands for
trimethylpyrin sulfonamide.
Right. Why would an antibiotic help with a parasite, and why does it work? And does it work better for feeding, or does it work better in the water?
So in terms of TMPS, it blocks essentially a folate or a necessary compound needed by the bacteria. So as long as that bacteria is using that compound, which is extremely common, that medication will tend to work. I tend to use that in a bath scenario rather than feeding, because I find that feeding is incredibly hard to know exactly how much medication the fish is getting. I think it's extremely hard to, one, target the fish that you're feeding unless it's the only fish in the system. In terms of bathing, we do have to be careful that when we do give baths with antibiotics, that we're not creating bacterial resistance. And the problem with the bath is that we use much higher concentrations of this medication. So there's a coin flip on this. Do we use the oral feeding and potentially over or underdose the fish, or do we use a bath and potentially lead to bacterial resistance?
Right.
And TMPS has been, it's essentially an old school drug. It's worked.
It's a sulfa drug with a bunch of sulfa medications.
It's worked phenomenally in many different industries for a long time. The hesitancy with it is that there has been reports of resistance developing to it, just because it's been around for a long time.
Right. And so you would use that in a bath.
Yeah.
For how long, that bath?
So again, it depends on,
I've never used that in a bath yet, but this is the first. I usually soak my nori. If I see some dots, I'll soak the nori in this med.
So when I use medications, or I use antibiotics in general, it's accompanied by a culture and sensitivity. So what I do is I take a sterile sample of the fish, of a lesion, of whatever I'm sampling, send that to the lab. The lab will grow the bacteria and then do something called a sensitivity, where they use different antibiotics and let me know which one's the most effective. If that's the case, and let's say TMPS is the most effective, then I'll run that bath. It's a bacterial static agent. So there is, again, if we get into the literature, some bactericidal properties to it, but in general, it's bacterial static, meaning that it doesn't kill bacteria, it just slows down the replication or halts the replication entirely. Once that replication has been halted, the fish's regular immune system then can take over.
So in this case, the TMPS can actually buy the fish time with ick.
Yes, absolutely. Right. If provided that it's using that folate mechanism.
Right.
In terms of the TMPS, it's essentially it's not a concentration dependent antibiotic, it's a time dependent. So the bath can continue because it's not the concentration that's killing the microbes that we're trying to kill. It's the time. So it's the amount of time for the fish's immune system to react. So sometimes if we have a fish that's in relatively good health, that may be significantly less time that the immune system takes to kill the organism in question. Whereas if you have a fish in, a more dire situation, their immune system may not be functioning as much. So that could, need a longer duration. That's why, and that being said, that's why I tend not to use TMPS in situations where the fish is already in a dire situation, because they don't have the immune regulation to move forward.
I agree. Let's get to the billion-dollar question. You have a reef tank, it's a couple of 100 gallons, maybe it's 17,000. You start seeing some dots, you start seeing some depths. How do you treat a reef tank effectively, or even get those fish out? What's the secret here? Or are we all doomed at the end? We're all in a wood box.
Unfortunately, I wouldn't pour any medications directly into a reef at this moment. I think it's something that between us will, hopefully...
Except for coral stuff.
Yes, if there's corals in the tank, I would not pour any medications in there. Hopefully in the future, maybe, here at Polo Reef, we can devise some things or do some experimentations to see what would be acceptable. But unfortunately now I would remove, if possible, every fish from that tank. Then at that point, treat all your fish, and then I'd leave that tank open or empty for 72 days. Yes, that's a very high number.
You're a 72 guy, you're not a 60, not a 6-week guy.
Yeah.
You that one case that was cold water.
There was one paper, but at the end of the day, if if I got all the fish out,
right? You might as well. Another couple of weeks.
Exactly.
You might as well wait.
Absolutely. You know, if you need to move them back in sooner, it's okay. But there's been nothing reported in the literature that says anything over 72 days. So I always play on the safe side.
And what do you say to the people? I can't get the fish out. I just they're dying every other day, and I can't get behind that rock.
So at that point, you know, if there's corals in the tank, it's unfortunately a dire situation. You can always make sure that you're feeding well, keeping stress to a minimum. Unfortunately, fish will pass, but hopefully some of them, you know, will develop an immune response to the ick particles.
And what if it's a velvet issue?
Then you're even in a worse shape.
Dude, it's the nightmare.
Yeah, no, absolutely. You know, again, some fish can make it through, but if you have a overcrowded, high-density tank where it's going to spread from one fish to another, it's a very sad situation, unfortunately. You know, if there wasn't coral in the tank, again, you have all the options we described prior, but every option we've described is detrimental to coral. So then at that point, you decide, are your fish...
Right, you might be taking out the coral and treating the display tank if you have to.
Yeah.
You might.
I mean, if possible.
Right.
You know, if you can get the coral out, then that's, you know, a definite possibility. But if it's, you know, if you've got acres that have been there for 10 years,
right,
you're not breaking them
right,
off.
Right.
So it does become a really sad situation of deciding, is your coral more important? Is your fish more important? You know, get out all the fish you possibly can, treat them separately.
You ever put them to sleep with the MSM stuff and get them a little night, then go get them?
So
could you do that?
So MS222, I tend not to use because one, it's carcinogenic, and also at the same time, it is, you have to buffer it, and it's, you know, quite tricky to use. There's other more easy alternative options for it, but if you're able to get close enough to use those medications, I would say scoop them out, and also I wouldn't use those, you know, anesthetic agents if there's coral around anyway.
I gotcha. Okay. Doc, tell us a little bit. Let's switch course here and talk a little bit about the life cycle of ick and velvet, and temperature, and where to go or where not to go. Obviously, you probably could go a little higher if the tank's fallow and speed it up.
Yeah, absolutely.
But you don't want to do that with the fish in the tank.
Yeah, absolutely. And also you don't want to do that with coral in the tank.
Right.
You've got a lot of nice acres on there. I wouldn't be fluctuating that temperature because again, that seems, you know, anecdotally to be a major stress on the corals.
Yeah.
And now you're causing stress to your corals,
right.
Which is ideally, you know, for most reef keepers, that's their pride and joy.
Right.
So I'd stay away from that.
Right.
Again, the option is if you don't have coral, then yeah, you can increase the temperature, speed it up potentially, but I'm always a 72-day type of person, just because there's virtually no documented risk after that. I would feel terrible if I waited, you know, 55 days, I had the temperature quite warm, and then I put my fish back and I had to start over again. I think for that extra 20 or so days extra, I think it's worth, you know, having that peace of mind to let me sleep at night.
Now, are you like that if you have a new piece of coral that doesn't have a rock on it, it's just coral tissue? Do you want that in a fishless system for 72 days too? Or you're not too worried about tomates attaching to live coral tissue, and it's more about rocks and plugs and stuff like that?
It is more about rocks and plugs. It gets down to how intense do you want to be with your quarantine and what's reasonable.
Right.
The correct answer is everything should be quarantined for regardless if there's tomons or threonts or not. Everything should be quarantined and watched, but again, we don't all have that capability to do so. So I think it's taking things with a grain of salt and being reasonable, inspecting it. Again, you know, is it theoretically possible? Yes. The likelihood is quite low, but if you want to be 100%, then I'd say quarantine it for 72 days. If you do
in a fishless system.
If it's
in a fishless system. In theory.
In theory, it's okay.
But that's difficult because then they fit the coral suffer for, they need to be dosed phosphate, nitrate, and food, and there's no natural poop.
No, exactly. And fish poop is a great source of energy for these corals.
Right. Yeah, tough decisions.
No, definitely it is. And I'm hoping that working with you guys, we can create a standard moving forward to, describe.
Just so the audience knows, when we get a piece of coral in from a tank that I don't know when the last time he added new fish in. Usually I say to the guy, or when was the last time you even added a new fish? If the answer is, I add new fish all the time, and there's rocks and plugs, it's staying in there 6 weeks or longer. If it's only coral tissue,
unlikely,
and no new fish, I'm less worried about it.
No, absolutely.
And so that's where I fall on the risk curve.
No, again, that makes perfect sense. It's at the end of the day, how paranoid do you want to be?
Right, exactly. Anything else you want to talk about velvet from a aerosol, virulent, warning?
So in terms of velvet, it can aerosolize. So if you do have your quarantine tank right next to your display, there are risks of it, water vapors carrying that parasite over to your display tank. I always like my quarantines in a completely separate room, if possible, on the other side of the house.
Right.
Just don't put it next to your air conditioner or something like that, where it's going to start spreading particles around your house.
Right.
Again, it's rare, but it's all about mitigating the risks. Everything, unfortunately, once you have that in your tank, then now, treatment options become very limited. So the only way to, prevent it is to never have it, or the only way to treat it is never have it. So never having it is the goal. So that's what the point of quarantine.
Too bad formalin's not reef safe, huh?
Yeah, no, absolutely. if it worked, that would be wonderful.
Yeah. Okay. Moving on to Brooke. Let's move on to Brooke, because even though it's not the same type of protozoa, it's a ciliate, right? People mistakenly confuse Brooke with velvet. The signs on the fish are very, very much the same sometimes. And the good news is a lot of the medications are the same, so you really don't have to know. But Brooke,
so
you're up.
I think a lot of people get confused because in the early stages of Brooke, you have a white coating that almost looks like
a dusting.
Yes, exactly.
Right.
But that white coating is actually, it's called desquamation, and that's actually the cells becoming lifted up off the fish, and then we get epithelial sloughing. And epithelial sloughing, or that skin peeling off the fish, is almost a pathognomonic finding for Brooklynella. So that's the easiest way to differentiate the two, is if you start seeing it peeling up. In terms of velvet, it'll be dusted and tightly adhered to the skin or the scales, whereas Brooklynella, it'll, the skin begins to lift off and you get bubbles under the skin, or you actually get, fragments of skin sloughing off the fish.
Right. Now, what % of the cases that you see Brooke are clownfish related versus non-clownfish?
I'd say, this is a rough estimate, 75% plus are clownfish, or at least the infection started with clownfish and then it spread to other fish in the tank. I mean, it does happen. It still, happens in tanks, but it's not nearly as prevalent. If you have a clownfish that has it, now they're essentially a factory for making Brooklynella, and now those parasite burns are much higher. And once we're in a closed system like a reef tank, there's nowhere for those fish to go. The parasite load just increases, so we get to a certain point where everybody ends up getting it.
Now, does UV work for these ciliates?
So sometimes they do, depending on the concentration or the intensity of the UV,
right.
But generally there is some resistance to it. It can help. UV, again, can, provided that the UV is the correct size for the tank and correct intensity, can be beneficial, but not every UV system is intense enough to kill these parasites.
Of course. And in the case of Brooke, tell us the similarities in treating it vis-a-vis, well, it doesn't respond to copper. We know that.
It does not.
That's the real difference.
Yeah, that's the major difference, is that it's generally copper resistant. So let's say you suspected it was velvet, you started treating with copper, the fish isn't getting better or getting worse, then I'd say, was it really velvet at the beginning? Is it time to reevaluate and possibly
How much time did we have with Brooke? Sometimes not that much time, right?
No, definitely not.
So again, it's the formalin shotgun approach.
Yeah, absolutely. And again, I'm a big advocate of formalin. Again, my problems with it is the toxicity to people. And that's what I try to avoid, is that if you're, constantly working with it, you're constantly breathing the fumes, there are side effects. And so it should be used with caution. If I work with it, wear a mask, wear goggles, make sure you don't get it in your eyes, don't get it on your skin.
Make sure Yeltsin uses it. Only. Okay. And chloroquine also treats Brooke.
If it's only at the epithelial tissue and it's only eating the skin, less likely than if it's already ulcerated, it's open, and it's got, access to blood and muscle. So chloroquine is based on, is the organism consuming blood? If it's consuming blood, absolutely chloroquine works great. If it's not consuming blood, then the other option of formalin is better.
Now, if there's sores on the fish, what do you do with then?
At that point, close the sores with honey, as we described before, and then you can possibly use the chloroquine phosphate, or at that point, if I have open sores, I generally switch to injectable medication.
We'll get into that injectable stuff in a later episode. On just wild clowns, or are we seeing this in captive bred aura clowns and so forth?
Clowns seem to be predisposed, but naturally caught or wild animals more likely have the parasite. In terms of captive bred, theoretically they can get it, but it's substantially less, unless for whatever reason that facility was contaminated or they had an issue. Most of the time they don't have these types of problems. It's the wild ones that I'd almost bet have some sort of external parasitism.
So you get a pair of wild clowns, we're nuking them with formalin some way, somehow.
Absolutely. So right. I always start, every new fish I get, I always start with a scale scrape looking under microscopy. Even if I don't find anything, then I would still leave it in quarantine and try again in a couple days. When we first bring in a fish, it's from the wild, it's been exposed to a lot of different things, the parasite burden on them is probably pretty low. And that's why we don't necessarily see these outbreaks in the wild the same way we see in our closed systems. In the closed system now, we've created an environment where that parasite can now proliferate or continue to reproduce more and more. So then once I scrape, if I see something, then I treat for what I see. If I see nothing, I wait a couple days, scrape again. I would say at least 4 scrapes of seeing nothing before I'd feel confident that there's nothing there. That being said, when I do my physical exams, it's scale scrapes, gill biopsies, fin biopsies, and it depends. If I find the information I'm looking for, then I'll stop. But if I don't, then at that point, I would anesthetize the fish, look at the gills. A lot of times the gills are the first part of the fish that gets attacked. So if I'm finding nothing on skin scrape, I'll always do a gill biopsy just to make sure that there's nothing hiding in the gills for later.
Now, if you're not doing scrapes and cut and going through microscopes, but you do quarantine, are you a fan of formalin baths before the fish even gets into quarantine, so there's no breakout in quarantine, or at least reduction of that?
It depends. If you have, a large quarantine system, then I would bath before, even though it's more risky. It does cause more stress.
Yes, it does.
But I'm a believer in terms of quarantine of an all-in, all-out system. So if I get new fish in, those are the only fish that are in that system until they're done and they leave.
Right.
Whereas if I had a quarantine system, let's say I got a fish in on Tuesday, I wouldn't add a fish on Thursday.
Unless you're ready to reset the clock back.
Yeah,
and stuff.
exactly,
right.
Exactly. You'd start everything over. The moment a new fish is added to that quarantine, everything starts over. So once once you've deemed that this fish is finished with quarantine, move it out, sterilize the system, and then you can add new fish. But I would never, have a fish that's been in quarantine for 6 weeks, add a new fish, and say that the old fish is still good.
Still good.
Definitely not.
That does not work. No. As long as we're talking about sterilization of quarantine tanks, how do you balance how valuable my bacteria is on those bioballs now, because they're used to the medications and I don't get ammonia spikes? And maybe I can cleanse it with chloroquine phosphate instead of bleach, and starting over with immature bacteria that I'm going to get an ammonia spike as soon as I put copper in, because they're not used to it.
Yeah, I mean, again, you still run the risks of not bleaching it. I always am a big fan of isopropyl alcohol to clean out a system.
We do it, but we leave this much water in the bioball chamber and don't want those bioballs drying out.
Yeah, no,
but
absolutely.
It's really not sterilized.
Exactly. Fortunately for, here, we do have a supply of other water we can use.
Yes.
A lot of times, if you're having a quarantine system, I would have, you have your larger display, I'd have some water to work with from that display, add it to the quarantine so you can get that nitrifying bacteria population back up.
Yep.
But again, in terms of if you had urinema in that quarantine tank, at the end of the day, I'm going to say to bleach it, even if it's a pain to get it restarted and get your quarantine back up. But now, once you put urinema in, or once you put any of these scutellociliocytes, even if there's no fish in the system, they can live indefinitely. They can live off other bacteria, they can live off detritus. So the only way would be to bleach it.
Right.
And I would, advise against, we knew that if we knew this tank had urinema, we treated for urinema, it wasn't found in any of the fish, it could still be in those bioballs. And then if we introduce new fish, that urinema could show its face again.
Right.
So again, it is a hassle to bleach, and it is a hassle to start over. But if you've already identified an organism, then I would say always, sterilize that system. If hypothetically...
Now, can you sterilize with chloroquine? Why can't I just put a high dose of chloroquine in and it takes care of the urinema?
So...
For a couple of weeks with no fish.
Because if there's no fish, they're not eating blood, and they're only eating other organisms or detritus.
Yeah.
And so then that medication wouldn't work. It's only if they're eating blood will chloroquine phosphate work.
Interesting. Good to know. Okay, let's just go through what's coming next episode. We're going to be talking about urinema, which is almost as much as a nightmare in a tight space as velvet.
Absolutely. Urinema is, I think, a large contributor to unspoken for deaths.
Right.
I think that it doesn't always present the way that we're taught.
Yes.
I think that there's many different presentations for it.
Yes.
It's one of
outside in, inside out. It's like belly buttons, right?
Absolutely. I've had cases of urinema that were purely internal until, but then when you're in quarantine, let's say you scraped, you didn't see anything. Then over time, if it's an internal infection, every time the fish poops, now that infection comes out, and then you end up getting an external infection. So I think that,
So we're going to get into all that and treating urinema. We'll talk about bacterial infections, which I know that's one of your favorites, and the stains and identification and which antibiotic is right. I know you're a big fan of injectables, but we're going to have to talk about the water stuff too, because some of these guys are not going to inject their fish. And then we're going to talk about flukes, and then we're going to talk about black ick and some other just worms. And then maybe we'll do a coral disease episode too.
Yeah, absolutely. I think there's just as much to talk about in coral diseases as there are fish diseases.
For sure.
And a lot of them happen to be, a lot of fish diseases are, single-celled protozoa, not very interesting to look at.
Right.
Whereas for the eye, a lot of the coral diseases are much more interesting.
Right. Anyway, before we end this episode, we talked a lot about just these quarantine systems and how simple they can be. Don't forget to look at our videos. We have 2 parts on how to set up the quarantine tank, et cetera, et cetera. All right, so with all that, I thank Dr. Hall for being here. This episode is concluded, and we look forward to the next one. Thank you so much, Doc.
Thank you for having me.
Don't forget to like and subscribe for the channel. Thank you very much. Good night.